My name is Dr. Jean Chamberlain Froese. I'm an obstetrician gynecologist and executive director of Save the Mothers. I'm also an associate professor at McMaster University in Canada. Save the Mothers was started in order to help many of the mothers around the world who are dying from pregnancy complications. And in fact, every year, nearly 350,000 mothers die from mostly preventable pregnancy complications. In addition to all of those mothers who die, nearly 4 million babies are either stillborn or die in the first week of life due to unsafe pregnancy. And where are most of these deaths happening? They happen in the developing world, in low-resource countries. And really, these are avoidable deaths. Save the Mothers is addressing the root causes of why mothers are dying in the developing world. Mothers die because of 3 delays. These delays are the delay in the home, the delay to reach the facility, and finally the delay in the health facility or hospital itself. The first delay in the home is simply because the mother may not have the money to go and seek care. She may not even recognize that she's having a complication. Being in labor for 2 or 3 days, well, she is in what we call obstructed labor. She's waiting for her husband's permission to actually go and get care. And in many places of the world, that is what kills mothers. The next delay is the delay in reaching the facility. She may not have transportation. She may not have the small amount of money she needs to actually get on the bus. And finally, the third delay is at the level of the health facility or the hospital. There may or may not be a doctor or nurse available. The important medications or equipment may not be there, or they may be broken. Sometimes there's no electricity or anesthesia that she needs in order to get the care for her pregnancy and delivery. All of these 3 delays together can end up killing mothers. And that's why, as we look around the world, mothers are dying at an unbelievable rate to avoidable complications. Save the Mothers is addressing these 3 delays. All 3 delays must be addressed in order to save mothers' lives. Save the Mothers is impacting the way people look at pregnant mothers, their value, making sure that monies are available for women in their homes, making sure that transportation is available, organizing rides, working with the communities to help sensitize people and educate people about the importance of safe motherhood. It is working with governments to help them have policies and programs to save their mothers. And finally, we're having an impact in the health facilities and hospitals as well to improve the care that mothers will get there. Save the Mothers is excited about our new initiative called the Mother Friendly Hospital Initiative. We will be working with hospitals and health units across Uganda in order to ensure that mothers have a mother-friendly environment to deliver in. I'm talking about a place where there's just the basic equipment in order to save a mother's life, where women are treated with dignity. Requirements will include having curtains and privacy for mothers. Can you imagine delivering on the floor with no curtains? No wonder women decide to stay at home to deliver. Simple medication called oxytocin, which all mothers should have after delivery to prevent bleeding. Ensuring that all of the hospitals have that. And how much does that medication cost? Only about 33 cents. So it is not an expensive endeavor. It's really rather the way we organize our systems and follow through to ensure that every mother is treated with dignity, every mother is treated fairly, that every mother gets at least the minimum standards in order to save the life of her as well as that of her baby. Save the Mothers is looking forward to a future where no mother or her child will die from pregnancy complications. And that is possible. We have all of the cures to prevent mothers and babies dying from pregnancy complications. The challenge is making sure everyone has access to it. But the simple solution isn't just to build more hospitals and clinics. It's also about changing the way people think about mothers and pregnancy. And that's what Save the Mothers is all about, bringing in students from all this region and training them about safe motherhood. These students aren't young, inexperienced people. They are already leaders in their own communities. And as they learn about how to prevent mothers from dying, they go back into their own places of influence and bring about change change that will be lasting, change that is part of the community to save the lives of mothers and their children here in East Africa. We are training journalists, social scientists, religious leaders, members of parliament who have brought new legislation in order to ensure safe motherhood. We've had teachers introducing programming into their schools, safe motherhood clubs, very practical things that are bringing about change in the way the community here and the way people think about safe motherhood. You might be wondering, how can you become involved in helping to save the lives of thousands of mothers around the world, to be an advocate for the voiceless? And you can do that by learning more about safe motherhood and what is happening around the world. You can join the Save the Mothers newsletter and get updated on what we're doing here. You can donate. Also, some people have very creative ideas. They organize walkathons, garage sales, all of these things, not only to raise support for safe motherhood and organizations like Save the Mothers, but also educating your community about the situation of mothers and their babies in the developing world. So let me encourage you to take the time to join our network of individuals who are promoting safe motherhood here in East Africa. Let me encourage you to join the newsletter to become a supporter of Save the Mothers.